Hello, I'm Dr. James Gills, founder of St. Luke's Cataract and Laser Institute. For more than 40 years, St. Luke's professional imperative has been to deliver the highest levels of precision and safety in cataract surgery. Most satisfying to me is witnessing the active lifestyles immediately restored to our patients after cataract surgery. At St. Luke's, we're here to give you life-changing vision. Love, understanding, and comfort are our priorities. One of my most important roles is selecting the best and most talented surgeons and staff. I'm proud to say that every one of them are equally dedicated to providing the highest level of medical care for our patients and are personally committed to carry on our tradition of excellence with love. Now I would like to introduce to you my son and president of St. Luke's, Dr. Pitt Gills.
In 1968, my father, Dr. Jim Gills, had a vision: building a top-quality cataract surgical facility and pioneering new technologies that have made cataract surgery one of the safest procedures performed today. In 2001, I joined the vision, and together we have the privilege of serving many patients. With safety, patient care our top priorities, our surgical center has a significantly lower incidence of complications than the national average. Advances in technology have allowed us to pursue maximum freedom from glasses after cataract surgery. We accomplish this by offering a wide variety of lifestyle intraocular lenses. We carefully match each lens with the individual's personal needs as well as their health and the integrity of their eyes. In this video, we will show you that many of our patients who have been diagnosed with cataracts actually consider it a blessing as they experience the amazing process of vision restoration. It's as if they were turning back the hands of time to see the world again, as they saw it when they were much younger. If you or one of your family members is suffering from cataracts, we invite you to watch the program as you begin your journey to restore your youthful vision. Thank you for your trust and confidence. We look forward to serving you.
I feel like a 20-year-old.
I'm getting my money's worth every single day.
I could read my Bible without my glasses the next morning.
Good vision is so important to our enjoyment of life, being with our family, working at our jobs or hobbies, expanding our knowledge, and taking in all that life has to offer. It's quite natural to be fearful when we notice our vision begins to deteriorate with symptoms of cataracts, glare and halos while driving at night, loss of color perception, and continuous blurring of vision can make everyday activities more difficult and less enjoyable. More than 50% of people over the age of 60 have cataracts already developing in their eyes. In fact, it is said that nearly everyone will develop cataracts if they live long enough. A cataract is a progressive eye disease that affects the clear lens inside the eye. At first, changes in prescription glasses can help, but over time, the lens inside becomes cloudy, brown, or yellow. This causes light to be blocked and scattered. Vision becomes blurry, and colors lose their brilliance. Left untreated, cataracts could eventually cause blindness.
My biggest problem was at night when I was driving, and all the lights had a halo around them. And I've worn glasses since 7th grade. And I had trifocals because I did computer work, and it just got fuzzy. I just couldn't see. I had glasses all over the house, one by the phone, one where I read, reading glasses and everything. But it was more fuzzy. But the halo around the lights is what really frightened me. I decided I better do something.
Everything in my right eye was very blurry. I was getting these weird halos around lights. And my vision had, without realizing, my vision had deteriorated greatly. So decided to come to St. Luke's and see Dr. Gills and have some surgery.
I'm 76 years old, and I've played golf since I retired from the Navy, and I've loved golf, always loved golf. I used to hit the ball pretty good, and I could putt pretty good. But it got to be where I couldn't read the greens. I couldn't putt worth a darn, you know. And the doctor finally told me that them cataracts are ready to come out. And I said, well, let's get it done, you know. As soon as possible, I'm ready.
Presbyopia is another age-related condition that affects most patients beginning around the age of 40. When we are young, the crystalline lens is flexible, allowing the eye to shift its focus from near objects to distant objects. However, as we age, the lens begins to harden, and we lose the ability to see up close without the aid of reading glasses. Having both presbyopia and cataracts is also very common.
I started wearing glasses, as everyone does, at around 40, 44. And I could not see the print. Everything got blurry, going farther, farther, farther away. And so this is what I had. I just had the reading glasses. It got to a point also where usually I would just put reading glasses on to read, and then it got where I needed it for other activities, or if I went to the store I had to put them on. And so I was taking them on, off, on, off, on, off. Got to the point where finally, about 3 or 4 years ago, I started wearing it around my neck, which I said I would never do, but I decided I would do that.
I didn't start wearing them until I was in my 30s, I think. And I would always forget them, and we live in a 2-story house where I'd always have to run upstairs and get them, and just got, you know, I just forced myself to see without them a lot of the time. I used to walk my dog every night, and I couldn't tell the people who were walking up the street to me. I couldn't tell who they were, and they were my neighbors, and I couldn't see them. And this, you know, told me I had to do something about it. It was bad.
Whether you are nearsighted, farsighted, have astigmatism, or presbyopic, the only way to clear up your cataract is to have the cloudy natural lens removed and your vision corrected with an intraocular lens. At St. Luke's, our cataract surgeons use the most advanced intraocular lens technology available. We call them lifestyle lenses because they can offer our patients maximum independence from glasses while correcting their nearsightedness, farsightedness, astigmatism, and presbyopia.
There are a lot of lifestyle lenses that are available nowadays, and it's very, very important to match the person's lifestyle with the lens. So we go through and we listen to the patient. First, we ask them what do they desire the most. If it is a high priority to not have to put on a pair of readers or magnifiers for up close, then obviously we're going to engage in that discussion. If there's someone who's more computer oriented, or if they're more reading, that's going to direct us one direction or the other. If there's someone that drives for a living at night, that's going to direct us in an entirely different direction. So getting to know the patient, listening to their needs, then we can tell them what they can expect realistically and what would make them happy.
Dr. Gills and his son Pitt as well, and Dr. Wiffley, will ask you, what are you interested in? What do you really do? And he knew that I was a golfer and a boater. When I first played golf, having my reading glasses before, I would always take those off. Couldn't ever have bifocals because they said your balance, everything is off in golf. So I just went ahead, hit the golf ball, and people would have to tell me where it was. But now everything is very, very clear. As far as writing the scores, didn't write that as well either. But now I can read everything, so it makes it very, very nice.
They offered me several different lenses. I chose the Restore lens, which I've been extremely happy with. Vision is as good as it was when I was 18. The lens is equally good both day and night. My distance vision is excellent. My reading or close-up vision is also excellent. It's just a great lens. If you're going to have it done, I would go to a place like St. Luke's that has the expertise. The lens is one thing, the doctor that installs it's quite another.
I have a girlfriend that had cataract surgery, but she didn't get the lifestyle lenses. And she was very envious because she has to wear glasses all the time, and she wishes that she didn't have to. She's got changing glasses when she's driving and changing glasses when you get out of the car to go in a store, and I don't have to do any of that. So she really, she's very envious of it.
I'm very active, and I do have a lot of hobbies. I do a lot of handicrafts. I knit, I crochet, I do beadwork, I sew. So of course being able to see really good really enables you to enjoy those activities, where when you can't see it can be very frustrating because you can't see what you're doing. So it's really helpful. And I go to the YMCA, I take part in classes, and of course it really helps to be able to see the instructor so you can, you know, partake of the activities and know what you're doing. So it helps to be able to see, definitely.
In 1974, St. Luke's Cataract and Laser Institute became the first practice in the United States dedicated solely to cataract treatment through the use of intraocular lenses. Now recognized as having the world's most experienced cataract surgeons, our patients take comfort in knowing they're in good hands.
I know my parents came here and they felt really good. They had Dr. Gills and they felt very comfortable here, and I just didn't even think of any other place, going any other place but here. I mean, they're world known, you know, they're fantastic doctors. And I'm happy I came here.
I chose St. Luke's because I did my research. If people are flying in from the backside of the planet to come here, that was one indication that I should probably look into this. Kings, queens, the rich and the famous, and guys next door. They come here because this institute did most of the leading research way back 35 years ago.
With safety and comfort as our priority, many of the surgical techniques pioneered by Dr. Gills have revolutionized cataract surgery and made it possible for many patients to enjoy their vision faster than ever.
The thought of eye surgery can be scary, especially for some patients. The best thing to do is think about a friend or a family member who has had cataract surgery at St. Luke's. If you can talk to them, they'll let you know about the experience so you know firsthand not to be too anxious and to relax and enjoy the experience.
For most patients, eye drop anesthesia will completely numb the eye and stitches aren't necessary because the eye's natural pressure seals the tiny incision through which the cataract is removed and the intraocular lens is inserted.
When you come in, you're going to be going through pre-op, where they're getting ready for surgery, and make sure you're healthy for surgery. Then of course you'll be in the operating room. At that point, someone's going to be there holding your hand. We're going to talk you through everything, and it's not going to be very long at all. Most people, it's about 10 minutes. Then you're going to be in the post-op period. We're checking you, making sure everything's healthy, make sure your pressure is good before you go upstairs. About an hour and a half after surgery, we're going to check you again. One of our doctors will check you, make sure your pressure is good, and that's just an added benefit that you get at St. Luke's. Most places you go home, come back the next day, we found it's much safer if you pick up that elevated pressure an hour and a half after surgery. 90 minutes happens to be the time that the eye will fill the pressure back up in the eye. So that's why we check you before you go home. And it also saves you a trip the next day.
I wasn't as afraid because Dr. Gills has such faith, and the whole institution does. And you just felt like somebody was guiding his hand, more or less. And I felt that. When you walk in, you almost feel like you're in a church because there are murals all over the place. It just has almost a serene being about the whole place. You just feel like that no matter what they do, it's going to be fine. Then when you go down to surgery, the lady hands you a little angel, and she says you just put it up on your shoulder. So that really makes you feel much better after that. It didn't seem like you were in there before you were out. And the first eye is harder because you don't know what to expect, and you're a little apprehensive. But after you've done the first eye, then the second eye is just, you know, it's just nothing to that. You're a little nervous, but with your angel on your shoulder, it doesn't matter. It kind of helps. But everybody is very professional, and they're just all real nice. Everybody looks like they were just handpicked by Dr. Gills in St. Luke's. They're so good.
It seemed like I was no sooner went in there and it was time to go, you know. It was very quick. Yeah, they made me feel very comfortable. Dr. Whipple was outstanding. He did his job, and before I knew it, he said, "We're done." But as soon as I could, I was out playing golf. Since I've had the surgery, well, I've really taken a lot of strokes off the putting part. I can really see the greens. I can really see the putt now. And my putting's gotten better. So my scoring's gotten a little better, which pleases me.
It is scary because, you know, I mean, if you think about the whole concept, you know, they're going to go into your eye and remove a piece of it and put a piece of plastic or some foreign material in there. That's a kind of a scary concept. But everybody at St. Luke's really tries to arm you with knowledge. So I think when you're informed, that really helps, you know, sort of dispel some of the fears that you have when you have that knowledge. It was over before I knew it had even started. I mean, you're there and then pretty soon they're ushering you out the door and say, congratulations, you're done.
We always do one eye at a time for safety reasons. We sometimes will do one eye a day after the other, but typically we do it a week apart. That gives you time to heal, make sure you're happy with the first surgery, and it gives us time to fine-tune our lens measurements on your second eye, which means more accuracy and a happier patient.
Well, the next day I could ride my bike, I could see people, you know. I mean, even that night, after I got home with my first eye done, I could see so much more. And then both eyes being done, you know, it's just amazing. You can drive at night, and I haven't driven at night in I don't know how long, a couple years.
Dr. Gills called me the next morning to see how I did. And I told him I could read my Bible without my glasses for the first time since I was in the 7th grade.
I was able to return to everything I wanted to do, including working out, within 48 hours. I asked the nurse when I was in there, I said, when can I go work out? I was working with a personal trainer. And she said, you can go tomorrow. It's like, oh, cool.
Not everybody is a candidate for the lifestyle lenses that provide a full range of vision, meaning you can see near, intermediate, and distance with little or no dependence on glasses after the surgery. But if you do qualify for a lifestyle lens, we are more than happy to offer our patients affordable financing options.
The lifestyle lenses are more expensive than the regular lenses, and that's considered a luxury by the insurance companies. So the patient, unfortunately, needs to bear the change for that. The way to look at it is that it is a gift that you're giving to yourself that will be there every day for the rest of your life. Not many gifts can you give to yourself that are there every day.
I wanted the best for myself. I've worked too hard in my life to give up on everything that I've ever strived for. And since I'm top medical condition, I want my eyes to be the best too. I had the opportunity. I went to St. Luke's. They gave me all the answers I want. I got what I paid for. I'm getting my money's worth every single day.
I'm absolutely enthralled that I made the decision to get the lifestyle lenses. The amount of money that you spend is inconsequential to the amount of vision that you have.
I'm really glad that I spent the extra money for these premium lenses, because at 63, my mother's still alive at 93, and I will have these with me for the rest of my life. So it just seemed to be really a no-brainer as far as adding the additional cost for them.
If you suffer from poor vision or think you might have cataracts, I encourage you to make an appointment to have a complete eye exam as soon as possible. After all, it's not up to us how long we live, but how well we see is a matter of choice. Our commitment is that we will do everything in our power to help you turn back the hands of time so you can clearly see all life has to offer, from the big picture down to the smallest detail. Excellence with love is my guarantee to you.
The love is definitely there when you walk in the door. Everybody is smiling. They go above and beyond, and they're very caring in that way. It just puts a smile on my face to know that I can see everything now. It's amazing. And also, in doing volunteer work here, I notice that it brings a smile to everybody else too after they get through. They're a little bit leery and they're saying, I'm not sure if this is really going to work, but when they come out, they just have smiles on their faces like I did. And I remember when Dr. Gills had called me the next day after I had it done, he said, well, do you feel like you're a 30-year-old? And I said, and I'm 63. And I said, no, I feel like a 20-year-old.
My husband says I have bionic eyes. I can read down below the expiration dates on things. All that little stuff that just looks like a blob on a prescription bottle, I can read it. And I can see the computer, I can see TV, I can see as far as I need to see to drive. So it's just fantastic.
The best part of my job is when I see post-ops and they get to tell me how amazing their vision is. I love being an ophthalmic surgeon. When I go to work at St. Luke's, I'm excited about making a positive impact in somebody's life. I know when I go home at the end of the day, I know we have made somebody's life better. That's what excites me, that's what I enjoy, and I'm blessed to work here.
It makes me feel very happy. I mean, I really like being able to see. I'm just so amazed at the results that I can see this good. So that makes me a happy person.